So continuing with the anatomical positioning in this PowerPoint and directional terminology. Anatomical position is referring to the way your body would be positioned in the sense of your anatomy. This position is feet slightly apart, your palms are facing forward, and your thumbs are facing away from your body. This is basically you're looking at a mirror image of yourself basically. Now when we're talking about directional terminology, these are paired terminology that helps us identify the relationship between different organs. For instance, the words superior and inferior, also referred to as cranial and caudal. Superior implies we're moving toward the superior part of the body or the top or your head, versus inferior means you're moving downward or toward your feet. Now, a way to explain this with an example is your head is superior to your shoulders. Your feet are inferior to your abdomen. When we talk about the second paired vocabulary for directional terminology, we use the word anterior and posterior. Anterior implies toward the front of the body, and we can also use the word ventral to describe it. Posterior means toward the back of the body, which we also can use the word dorsal. For instance, if you're taking a look at the breastbone, behind your breastbone you have your heart. So to describe the relationship between these two, I can say that your heart is posterior to your sternum, or your sternum is anterior to your heart. Medial versus lateral. If you assume that there is a line that goes in the middle of the body and dividing you to two equal halves of right and left, if you're moving toward this medial line or this midline, we refer to it as medial, and if you're moving away from this midline, we use the word lateral. For instance, the relationship of your heart and your lungs. Your heart sits between the two lungs, so I can describe its position as heart is medial to your lungs, or your lungs are lateral to your heart. Now, if you have a structure that sits between a medial and lateral structure, we use the word intermediate. So taking your shoulder bone, or your collarbone, as I said, not shoulder bone, your collarbone sits between your shoulder and your sternum. So this is an intermediate bone. So collarbone is intermediate between your breastbone and your shoulder. Proximal versus distal. When you use the word proximal means you're getting close to the origin of the body, versus distal, you're moving away from that origin. For instance, the point of attachment for your arm is your shoulder. So if you take that as the point of attachment, you also have your elbow and you have your wrist. So the relationship between the elbow and wrist will be wrist is distal to your elbow because it's farther away from your shoulder, and your elbow is proximal to your wrist because elbow is closer to the point of attachment. The other two words is superficial versus deep, external versus internal. So superficial, if you say somebody has a superficial cut, basically means it's on the surface, it does not go deep. So if you're moving toward the surface of the body, we use the word superficial, and if you're going in depth internally, that's the word we use. We use the word deep to describe it. Now, looking at the body systems, we have two divisions. We have axial and appendicular. We also define these or utilize this terminology to define the skeletal system. Axial defines your head, neck, and trunk, and appendicular describes basically your upper and lower limbs, your legs and arms. Regional terminology are going to be designated for specific parts or bodies, divisions of the body. So taking a look at this picture, and you should be comfortable with this picture. I will not be covering every name on this, but to just kind of highlight some of the essential names on this, I will point this out. So anytime I use the word cervical in any time, cervical implies your neck region. Cephalic refers to your head. Thoracic refers to your chest cavity. Abdominal refers to your, basically, the abdominal region. Pelvic is this area in the middle where you have basically the reproductive, urinary, and digestive ends. You have pubic area, which is your genitalia. Lower limbs as a whole, which is basically starts from your thigh all the way to your toes. And your upper limbs, which basically describes from your shoulder all the way down to your fingertips. Again, you can see there are certain words underneath it that describes it. Some of them are self-explanatory, such as frontal. Frontal means in front. Orbital means around, right? Orbit, circular. Nasal implies nose. Oral implies mouth. Mental implies chin. External comes from the word sternum, so your breastbone. Axillary implies under your armpit, and mammary implies basically breast tissue. You can look through the other ones, and if you have any questions, please let me know. Similarly, we have vocabularies to describe the back. We have the vocabulary for the upper limbs. We have vocabulary for the hands and arms. Hand, arm, and the lower limbs. And we have descriptive vocabulary for the back. Now, when we look at the planes of the body, this is basically describes the way we can divide the body to use it to study anatomy. So we can divide the body through three different planes. Sagittal also can be called mid-sagittal if the line is in the middle, frontal or coronal plane, and transverse, also known as horizontal plane. So take a look at this. Sagittal plane, as I said, is going to go throughout the body and is going to divide the body to left and right. You can see how that cut would look like under a diagnostic tool. So in this case, it's dividing your body to the left and right. And if this line is right in the middle, we refer to this as mid-sagittal, as it's described in the picture. Now, if the line is dividing your body to the front and back, so we use the word frontal or coronal to describe this. So for instance, this picture is representing the thoracic and part of the abdominal cavity. This is your heart right here. These two yellow structures are your lungs. This is your liver right here, your stomach right here. And again, these are basically your shoulders and your arms. Transverse, anytime you hear the word transverse, it implies horizontal. So as you can see, you're cutting the body to the superior and inferior portions. And this is a cross-section of the abdominal region to kind of orient you. This is the front, this is the back. How can I say that? Because this, you see right here, is your bone that forms your vertebral column. This gigantic structure is your liver, and I believe this is your stomach. Oh, sorry, this is your liver, and that's your pancreas, and that's your stomach. So, now looking at the cavities you have within your body, we have two main types of cavities. Cavities that are in the front and cavities that are in the back. If you guys remember, the word dorsal implies back and ventral implies front. So cavities that are in the back and cavities that are in the front. So the frontal cavities or your ventral cavities are represented in red and are including thoracic cavity, abdominal cavity, and pelvic cavity. Now, abdominal and pelvic cavity together are referred to as abdominopelvic cavity. Now, taking a look at this, in the ventral view, you have the thoracic cavity, and thoracic cavity itself is broken down to smaller pieces. You have the superior mediastinum, which is the area you see right here. You have the structure that holds your heart right here, and this is referred to as pericardial, and we will come back to this again. And these two cavities, one right here and one right here, that are basically surrounding your lungs, are going to be referred to as the pleural cavity. This large cavity as a whole, this whole structure, is referred to as the abdominal pelvic cavity, which is broken down to abdominal and pelvic. Know what structures we can find in it. So abdominal cavity contains your digestive viscera, pelvic cavity contains your bladder and reproductive organs as well as the rectum. Looking at the posterior or dorsal cavity, you have the cavity that holds the brain, and this is referred to as the cranial cavity. And you have the extension that extends below your brain and holds your spinal cord, and this is referred to as the vertebral cavity. Here is a little more discussion about what these body cavities include. Now, interestingly, the membrane that are found inside or surrounding these cavities are referred to as serous membrane or serosa. Membranes that are found in these regions that basically surround the organs within these cavities are referred to as serosa or serous membrane. These are all double membrane. This is essential for you guys to remember. It's a double membrane and are referred to as parietal and visceral. Parietal and visceral. Parietal is the outer membrane. Visceral always referred to the inner membrane. Depending on the organ, the second part will be changed. So we don't use the word serosa. We use that part to describe what organs each are associated with. For instance, if the double membrane surrounds your heart, we refer to it as parietal and visceral pericardium. If they're surrounding your lungs, we use the word, instead of serosa, we use the word pleura, parietal and visceral pleura. If it's within the abdominal pelvic cavity, we use the word peritoneum, parietal and visceral peritoneum. Here's an idea of describing what that looks like. So right here you have your lungs, right? Two blue structures. And see, you have one blue line right here, and then you have one blue line outside, right? The inner blue line would be referred to as the would be referred to as visceral pleura, and the outer line you see right here would be your parietal pleura. And the gap between those two is referred to as the pleural cavity. And this cavity is filled with fluid with the role of lubrication. Within the abdominal cavity, you have similar membrane, the double membrane we're discussing. This one right here would be your parietal peritoneum, and this one is referred to as your visceral peritoneum. You can see it wrapped around your liver, your stomach, and the folds of the intestines. Again, you see this area that I'm shading right now, that's going in the lighter blue. This is the cavity called peritoneal cavity, and it's filled with serous fluid. Before I forget, not all the organs of the abdominal cavity are surrounded by this peritoneum. There are still organs in this region that are not part of this cavity, that are not part of this double membrane, and they're referred to as retroperitoneal space and contains retroperitoneal organs. These organs include your pancreas, your kidneys, ureters, and part of the digestive system. Last few slides describes the breakdown and segmentations of the abdominal pelvic region. If I use the word quadrant, quadrant implies 4 regions, and that basically implies that this section is broken down to 4 pieces. If we're talking about regions, we're breaking this structure to 6 sections. Sorry, to 9 sections, not 6 sections. So this is actually incorrect right here on top. So please change that and understand that there are 9 abdominal pelvic regions, not quadrants. I'm just gonna make a correction now. So I'm gonna erase this. So this is 9, still abdominal, sorry for the writing. Abdominal, I feel like, sorry, I am learning how to use this right now. Okay, so this is 9 abdominal regions, and it includes the right and left hypochondriac. This means chondriac imply cartilage, so hypochondriac means below cartilage, which are basically parts of your rib cage. Epi means surrounding, so epigastric means surrounding your stomach. We have the lumbar region. Lumbar means back. So we have right and left lumbar region. Everybody knows what umbilical is, so I'm not going to describe it. You can see the region for the umbilical cord. You have right and left iliac because there is a bone underneath it which is called ilium. So that's where the name iliac comes from. And hypo again means below, so hypogastric means below the stomach. This region is also referred to as the pubic region. Again, even though it's not on this slide, please do understand that this abdominal pelvic region can be broken down to 4 regions, as you can see. So the red separation, and this would be the right upper quadrant. This would be left upper quadrant. And I'm not writing the rest, but you guys get the idea. This would be right lower quadrant. And then the last one would be left lower quadrant. For this slide, I do want you guys to know one thing, and where these structures and organs are located in a sense of your regions and in a sense of your quadrants. So keep that in mind when you're studying for this PowerPoint. And that's about it right now.